Are you dealing with low back pain, stiffness, movement restrictions, or quality of life problems because of your back problems, maybe your hip problems, or maybe even sciatica? These problems can be frustrating and irritating. And what I find is a lot of people, unfortunately, just accept this as part of their life. They accept that they just have to live with it and it's a part of aging and that their symptoms are only going to get worse. If this sounds like you, I want to talk to you. My name is Dr. Chad Shafer. I'm a physical therapist and low back pain expert here in Troy. And I just want to give you some hope that this is going to get better. Some information about how to self-manage this and why you don't have to wait till this gets worse. What if your symptoms did get worse? What would your life look like? Would you have to take time off work? Would your quality of life degrade? Would your pain increase? I want to help you prevent that and help you just get back to the life that you want and you know you deserve. I had a patient the other day who was honestly pretty inspiring because of the story they told me. They had told me that they found this information online. They got to my website. They weren't really sure what to do. There's a bunch of information. They've been told by a lot of other healthcare practitioners that their back pain is just one of the worst things they've ever seen. Their back is all messed up. It's due to degeneration. It's due to arthritis and disc bulges. Now, if you think about those terms, they're really scary. And a lot of people aren't really sure what to do with that. And unfortunately, it actually makes a lot of people worse because when they hear those terms, you have a disease, or you have this, or you have that, people tend to not move as much. They start to have this concept in their mind that their back is fragile. They have to worry about their back and they have to just, kind of hang out, maybe take pills when it's worse, maybe consider injections or surgery. I'm here to tell you that you do not have to do any of those things. I'm here to give you the best information about yourself and your health care. And this person was really inspiring because she went from a position where she was having chronic back pain for years. And the biggest thing for her was she was able to lift a little bit better at home. She was able to improve her quality of life. And she was able to decrease her reliance on opioid medications and be a little bit more active to the point where it actually helped her with her back pain and her symptoms that she was having. She was frustrated to begin with because so many people told her that her symptoms were only going to get worse and she's never going to make it. Well, I'm here to tell you that she did really awesome, and it was really inspiring to see her improving her quality of life and doing all these things completely naturally. She didn't have to use medications, any sort of fancy injections or surgery that in most cases honestly doesn't help in a lot of people's cases. Now I want to give you that same option because I'm here to tell you that you don't have to live with your back pain. You don't have to fear your lower back. If you look at the structure and the function of your lower back or your lumbar spine, it's actually really strong. And if anybody has ever told you that, hats off to them because your back is strong. It is resilient. You can depend on it. You just need to find the techniques and the methods to help you get a little bit stronger, move a little bit better, so you can reach those goals of maybe waking up in the morning with less stiffness, maybe sitting a little bit longer with less back pain. Maybe your goal is just to simply drive to work and work without having to constantly think about your back problems and your back pain. Now, if this sounds interesting to you, I want to help you. And I want to give you the best information about yourself, your low back health, and what you're dealing with as it relates to your quality of life and your overall health. Now, I have a couple of different options because I think it's important to give this information to as many people as possible because, again, you don't have to live with these problems. Arthritis, degeneration, disc bulges, those can sound really scary, but I'm here to tell you that relief is actually easier than most people think. A lot of people think that your symptoms, you just have to wait till they get worse, or you just have to live with it, and that's a part of age and aging. Again, I'm here to tell you that's absolutely not true. So the three options that I have for you that I think is going to be the most beneficial for yourself and your overall health. The first option is completely free access to me. Ask some good questions. Figure out what you're dealing with. I'll email you back pretty quickly, and hopefully we can get you down the road of recovery. In addition to that, I have the ebook, The Secrets to Lower Back Pain. Now, this is an absolutely free resource that you can download today, and you'll find that it'll hopefully just answer some questions for you and hopefully give you a little hope and insight on why you don't have to live with your pain from arthritis and degeneration. Even if your symptoms were eased, maybe they got better by 10, 20, 30%, what would that do for you and your overall health? Would you be a little happier throughout the day? Would your relationships that you have with your friends or family get a little bit better because you're not as stressed out and you're not in so much pain all the time? I want to give you that option. So check that out. It's got a lot of good information about yourself, low back problems, and how to move past this and how to start self-treating yourself. So again, that's the free ebook and the email resource. The next option is called the discovery visit. Now, a discovery visit is something that's just simply a conversation. The conversation between you and me. Because back pain, and what we know about back pain is that it is complex, but relief shouldn't be. And I want to give you an option to tell me your story. I want to give you the option to finally figure out why prior treatment has failed in the past for you and why medications really is not the answer to what you're dealing with in relation to low back pain, maybe hip or even sciatica-like symptoms, because we know in most cases they're related. And I want to give you this option either in the clinic here in Troy or simply on a phone call. Let's pick up the phone, let's chat. No pressure, no tactics. Let's just figure out what you're dealing with, what your goals are, and how to make the most meaningful progress to those goals so you can finally get back to the life that you want and you know you deserve. Now that is the discovery visit, and a lot of people enjoy that because it just gives them some good information, some information about why they don't have to deal with this and what to do about it. So let's move on to the next option. The third option is going to be an evaluation. Now, evaluation is for someone who is looking to take action today. They're looking to figure out what they're dealing with. They realize that maybe their symptoms can actually get a little bit better. Maybe this sounds like you. An evaluation is a full 60 minutes with yourself and me. Again, it's a conversation, but it's also a full evaluation. Let's look at how you move. Let's look at your strength levels. Let's look at how this back pain affects your life and what to do about it. Because I'm here to tell you that most people find relief in just a couple of short sessions. And the biggest pillar of treatment that I have is self-treatment. I don't want you to see me for the rest of your life. I want you to figure out what's going on. I want to help you along the way. I want to help you decrease your back pain so you can eventually help yourself take your healthcare back into your own hands. Now again, if this sounds interesting to you, I want to talk to you. And those three options are a free ebook or email correspondence with me. Check it out, completely free, no pressure. Number 2 is going to be a discovery visit, 15 to 20 minute conversation for somebody that is kind of interested but they're not really sure what to do about their symptoms and their quality of life. Evaluation is the number 3 option, and it's going to be for somebody who is really ready to go. They know they have a problem. They're sick of dealing with back issues and back pain or movement restrictions, and they're ready to take action today. Now again, I hope this information was beneficial for you, and I want to give you the best information about yourself, what you're dealing with, and finally how to move past this so you can get back to the life that you want and you know you deserve.